I'm Dr. Ted of Jefferson Orthopedics, and this is Fracture Friday. This time I have here some x-rays. This is an AP of the humerus, which is the bone in your arm, the upper part of your arm. It's a distal diaphyseal comminuted fracture of the humerus. Now this particular fracture has a large butterfly fragment, which means that it has this V-shaped kind of piece that kicks out to the side, mostly with a lateral sort of blow type injury where someone hits the side of their arm and the arm breaks. This patient happened to break his arm just in a simple trip and fall injury, and this fracture happens to be a grade 2 open, but we talked about open fractures before and I didn't want to go back into that, but it does mean that the bone did come through the skin, so that is important to note for the patient's care. The lateral shows is a little less dramatic. The lateral shows kind of less of the comminution and kind of more of the fracture, and that's what you see in this x-ray here. So what we do for this fracture is an open reduction internal fixation, which is kind of the common stuff for us orthopods to do. In other words, we make a skin incision and put a plate on there. It's interesting to note on these x-rays here, which is what's called the AP, which means it goes anterior posterior, front to back. These anterior posterior x-rays, AP x-rays, of the humerus show that the plate, it looks bent. Well, that's because I have to bend it to mimic the distal end aspect of the humerus. Also, when you look at these x-rays, you'll note that there's one little tiny screw. So one of the interesting things to note about the distal humerus is you have an olecranon fossa, which is a hole where the olecranon process of your elbow fits into the back of your humerus. So we don't want to put a screw straight back into there, because then that olecranon won't fit into the back of your elbow and you won't be able to extend your elbow, so it has that little half screw at the bottom. That's about all I had to say about that, so thanks for watching my videos. Hi, Dr. Ted. Thanks for sticking around after the video. If you'd like to see some more content from us, please subscribe to the channel and like this video.